how important women are in making health care decisions for themselves and their families.
Well, so women are often the chief medical officers of their homes, and if you think about one of the first big healthcare experiences that you have if you've been relatively healthy is having a baby, and so that disproportionately falls, on the women's shoulders, and then growing the baby into pediatrics and all of the other decisions for the family oftentimes is controlled by the women. So I think one of the things that we saw when I started Maven 5 years ago is if you just designed a business and a system that really focuses on women as the primary consumer of healthcare, you could design a better system.
So how does Maven work?
So we have a lot of different digital programs, from IVF to egg freezing to pregnancy to early pediatrics and adoption. And you enter our digital programs, you have access to our telemedicine network, which has over 20 different types of clinical, behavioral, and wellness specialists. And you can talk to them at any time of the day, of the night, whenever you need it. It could be anyone from a lactation consultant to an OBGYN, a women's health physical therapist, an adoption coach. And then you get a care concierge that also helps you navigate this kind of huge experience.
Is this covered by insurance?
So we sell primarily to employers and then health plans. So yes, your employer would cover it or your health plan would cover it.
So what's to stop other healthcare providers from offering more services to women?
You mean like hospital systems?
Right.
And I think that one of the biggest problems has been that the lack of specialists that are covered in the system. So for instance, lactation consulting, women's health physical therapy, these are breastfeeding and recovering from childbirth are huge issues, but oftentimes they're not really in network. And so by providing, maternal mental health is another big area. A lot of times an insurance network won't have maternal mental health specialists that can help women through postpartum depression. So when we built our network, we built it with an eye towards specialty in this part of healthcare.
So there are other telemedicine companies out there, doctors on demand, mail order services. What separates you from them?
Well, so we run the largest women's health network, so they don't have any of these types of specialists that we do. And then, the programs that we've built, maternity, fertility, they don't offer any of those programs, so it's pretty unique to us.
So what do you say to the folks who argue that virtual care can create a disconnect between patient and specialist, or that patients are not cared for as well if all of their care comes virtually?
So we're very much a complement to what's going on during IVF for pregnancy. So our OBGYNs, for instance, are so grateful that we're in the picture, because when their patients are coming to them and they're complaining of issues that have to do with, mental health, nutrition, things that are out of their control, they can actually refer them to Maven. And I think the other kind of bigger point is that OBGYNs and just doctors in general are extraordinarily busy. But patients have a ton of questions. And so if they're able to kind of have a support network to get a lot of those questions answered before coming into an in-person visit, then it can be just a much more effective and efficient in-person visit.
Now, is one of your goals then to keep more women in the workforce? And if so, how?
So one of the big statistics that is a bit disturbing is that 43% of new moms drop out of the workforce in the first 52 weeks after having a baby, and 75% of them are saying that they actually wanted to stay in. And so, a lot of, when we really dug into those issues, it was, sometimes it was issues that we couldn't control, like childcare or financial issues, but other times it was just not having the right manager, not returning to work in a supportive environment, physical issues that just kind of carried over into, a short paid leave. And so what we do is we really help people in this kind of postpartum and return to work period get back on their feet, get healthy, talk to career coaches, talk to back to work coaches. And then by the time they enter the workforce, they're that much healthier and confident, and they're ready to go. And then we also have part of our return to work program has manager training, so we're able to then feed back at an org level, what are some of the issues that some of the employees are facing when they return to work and how to make it better.
So what's your outlook more broadly on how technology will continue to change the healthcare market? I mean, healthcare has been one of the industries that's been very slow to change, very slow to adapt to technology. So, is it completely different in, let's say, 5 years, 10 years?
Great question. So
I can't even email my doctor.
I know. I've just come off like 2 months of healthcare conferences where everyone talks about this. And so I think that really the jury says that, healthcare does take a while, but within, 10 years, you're going to start to really see meaningful impact on just not only virtual care, that's what's one of the most exciting trends, obviously, but really leveraging AI to solve some of these more complex medical cases and to make everything more efficient.